Welcome to the 2019 graduation ceremony of New York University's College of Global Public Health. Please rise for our special guests, administration, and faculty. Please welcome Cheryl Healton, Dean of the College of Global Public Health.
Good afternoon. As Dean of the College of Global Public Health, I'm privileged to welcome you to the historic United Palace for our 2019 graduation ceremony. This afternoon, 375 of you will graduate. Congratulations. Along with your family and friends, we are enormously proud of your accomplishments and consider it an honor to have been a part of your academic career. As you leave Washington Square with your hard-earned degrees, I want to remind you just how much we need your new expertise and skills in today's public health workforce. You are well poised for careers where you will improve lives for a living. This has been a noteworthy year for public health. The current administration in Washington has used every tool available in an effort to dismantle the Affordable Care Act, including rolling back critical provisions that allow people with pre-existing conditions like cancer, addiction, or pregnancy to access health insurance. At the same time that many politicians say they support access to health care for those with pre-existing conditions, they in fact are working against that provision in Congress and through the courts and even now in our state legislatures. Measles, declared eradicated for 20 years in the United States, is back and with a vengeance. Vaccine rejection is now sadly a tool of right-wing politicians and is fueled by rampant misinformation on the internet and indeed a rejection of science. In one European country, the current leaders ran on the slogan, "No jab for kids." They won, and later outbreaks of vaccine-preventable diseases occurred as a result of their lax policy on vaccine requirements for school-aged children. But they appear to be now reversing course, and here in the U.S., even our own president is now thankfully extolling the virtues of vaccines he once disparaged as causing autism, a long-debunked myth. There has been a resurgence of Ebola, and with it a new vaccine. Sadly, Doctors Without Borders needed to pull back from its frontline efforts in response to fear-induced attacks on 2 treatment centers in the Democratic Republic of the Congo. All of these challenges and opportunities remind us that public health is a demanding, exciting, and complex field. It holds the key to reducing gross disparities around the globe in life expectancy and well-being. Even here, in the world's richest nation, our life expectancy lags far behind other countries, now placing 53rd in a recently released 2019 ranking. We, too, have our work cut out for us. I know all of you will apply your hard-earned skills and knowledge to the relentless challenges we face. The world will be a much better place for it. As you begin or continue your careers or pursue other degrees, you know that public health is more than a job. It is a calling. With your diplomas firmly in hand, you are now poised to answer that call. NYU has been granting degrees in public health for 40 years, but like you, GPH is young with big aspirations. It is just our 4th year, and we are especially proud that GPH was recently named one of the best graduate schools in public health by U.S. News & World Report. Thank you for being part of these early formative years. On the occasion of our 4th graduation ceremony as a college, in addition to your esteemed classmates and faculty, we're honored to have a remarkable group of speakers here to inspire you. NYU's Vice Provost for Educational Technologies, Clay Shirky, will introduce our keynote speaker. Clay is an acclaimed author and one of the finest thinkers on the internet revolution and a leading voice on the social and economic impact of internet technologies. I'd like to now welcome to the podium Clay Shirky, a tireless champion of our college. Clay.
Good afternoon, and thank you, Cheryl. As Vice Provost for Educational Technologies, it's my honor to represent New York University's President, Andy Hamilton, at the College of Global Public Health's graduation ceremony here at the United Palace. And what a privilege it is to be here with you today. Just as the graduates who walk across this stage today will make public health history tomorrow, the United Palace is an inspiring historical setting for this important occasion. Since 1930, this theater has been a transformational hub of creative expression and personal growth designed with and for the community. And as the College of Global Public Health celebrates only its 4th graduation, this young, ambitious college is also transformational, seeking creative solutions to the world's most pressing public health crises. It's designed to benefit all people, especially the most vulnerable populations with the least access to care. Our graduation speaker today knows a great deal about the impact of social determinants on health and about what's required to ensure that public health services are run compassionately, equitably, and effectively, especially for at-risk populations here in the largest city in the United States. As New York City's Deputy Mayor for Health and Human Services, Dr. Erminia Palacio is in charge of coordinating transformation efforts across New York's public health and healthcare system. She oversees 11 city agencies and mayoral offices and is responsible for protecting the health and well-being of all New Yorkers, almost 9 million of us. Dr. Palacio comes to her role as deputy mayor with 25 years' experience, including academic and clinical medicine, governmental public health, crisis management, and philanthropy. Who better to inspire you today as you graduate? Dr. Palacio received her medical degree from the Mount Sinai School of Medicine, holds a Master of Public Health from UC Berkeley's School of Public Health, and earned her BA from Barnard College at Columbia University. And it is with great pride that I join Dean Healton and the faculty of the College of Global Public Health in welcoming Dr. Erminia Palacio.
Good afternoon, graduates. Thank you, Vice Provost Shirky, Dean Healton, for welcoming me today. Thank you to the university, the faculty, staff, and students for allowing me to be part of this celebratory day. The Global College of Public Health is a young school, but it stands on a rich history of NYU educating future leaders. And since it was established a few years ago, GPH, as you've just heard, has quickly proven itself to be a national leader. In addition to the education students get in the classroom, there's all the learning that happens by being in New York City. A city that in one subway ride can bring to life all you've learned in your books about the interplay between environment, wealth, neighborhood, health. And whether you go global or stay local, you're learning here at NYU and you're leaving with a world-class education and skills for the future. So graduates, congratulations. I know it's been a long road and it's been challenging at times, but this is a huge accomplishment, a life-changing milestone, and the beginning of a wonderful journey. And although this is your graduation, we can't go without acknowledging the loved ones who helped get you here. In public health, we know how much influence your community has in your life trajectory. So to all the people who make up your community, to those who are standing here with you today, and to those who couldn't be here but have stood with you in your hardest moments, on this day we also celebrate them. In my own life, I know that my mother dreamed of an education when she was young. But as an orphaned great-granddaughter of enslaved people in Cuba, an education was an opportunity beyond her grasp. She had to put away her books and her dreams just to survive. but she worked hard all her life to make sure the opportunity denied her was within my reach. So today I have a special shout out to those who were forced to put away their books so that we could open ours. A graduation keynote is supposed to be inspiring, but I have to admit, the person feeling pretty damn inspired here today is me. You see, a couple of weeks ago, I had the pleasure of getting coffee with a young graduate who is in the audience today. She knows who she is because, well, she was sitting with me in the coffee shop. But what she doesn't know, because I wanted to save it for everyone to hear, is just how much she inspires me, how hard she's worked to get here, the clarity with which she speaks about the world about her, and how determined she is to make the world a better place. And sitting with her at that coffee shop made one thing crystal clear to me. You, the newest generation of public health professionals, are not here because you are the future. You are here because the future is now. So I want you to take a moment, look around you, draw inspiration and strength and hope from those surrounding you, because these are the faces that will be by your side as you take this field to new heights. And I, for one, can't wait to see where you take us. Looking out at all of you today, I imagine many of you are thinking about what lies ahead. I wish I could stand here and tell you I know your path, I know the way. But here's the thing. Even if you embark on the most perfectly paved path, you may end up in completely uncharted territory. When I was coming up, my life wasn't even imaginable to me. I couldn't conjure up the opportunities I'd have, the kinds of things I'd get a chance to do, because I didn't even know some of these things existed. When I was in college, I thought if I work super hard and I get really, really lucky, I would get into medical school and become a doctor. I would see patients in a large urban setting. And I actually got to do that. And it was awesome, and it was unimaginable. But what was to come? Not even on my radar. As a young clinician, I kept thinking about all the things I couldn't change about my patients' health just by treating them in the clinic. So I went to public health school, curious to know what was out there and what else I could do to keep people healthy. And it was one of the best decisions I ever made. Public health school opened my eyes. Public health school expanded my horizons. But even after receiving my MPH, I still had no idea what was to come. Not in a million years did I think this pipsqueak from the Bronx, this daughter of 2 Black Cuban immigrants, never did I for a nanosecond imagine that I would one day serve as deputy mayor of New York City. My mom, like most Cuban mothers, gave me a lot of advice over the years. But reflecting back, I realized there's one piece of advice that I've carried in my heart and in my mind and in my soul throughout my entire professional life. And I'm going to share that piece of advice with you today. She said, "Mija, opportunity may knock, but it is really up to you to be ready to open the door." In the world of public health, answering those knocks and opening those doors can sometimes mean stepping into the unknown, confronting challenges you may not quite feel equipped to handle. But as I look back, I found and remember that those loud, scary knocks on those big, scary doors were often the very moments when I was standing at the threshold of unexpected and profound opportunities to help people in need. For me, one of those knocks came in August of 2005, an unexpected call that would forever shape my understanding of what it means to be a public health practitioner. At the time, I was the head of a local public health agency in the largest jurisdiction in Texas. We were all watching Katrina barrel up towards New Orleans with concern and empathy, and admittedly with quite a bit of anxiety because living in Houston-Harris County meant we too were in hurricane country. But when Katrina finally made landfall on August 29th, we were initially relieved because the damage didn't seem as bad as it had been predicted. But then the levees broke, and water started pouring into the city. So at 5:08 a.m. on August 31st, 2005, I received a call from the governor of Texas, letting me know that he'd agreed to accept tens of thousands of evacuees, that they would start arriving in about 36 hours, and that the responding agencies were to report to the Office of Emergency Management immediately. An hour later, walking into that room full of crisis management experts, it came as quite the surprise to see my name next to a box that simply said Medical Branch Director. Let me break that down for you. Being Medical Branch Director meant I had about 3 days, or so I thought, to set up an entire public health infrastructure for a pop-up city of 27,000 people who had just lost everything. And we had to do this all the while still providing critical public health services for the millions of people in our jurisdiction. This was a sobering responsibility and a tremendous privilege. I was so fortunate to have a fantastic team, but this had never been done before. And emergency response was not my area of expertise. This was one of those big, scary knocks on a terrifying door. And frankly, I did not feel quite ready to open it. But the senior command said, "Doc, we want you to do it." So terrified and all, I remembered my mother's words, and I opened the door and I walked through. Turns out we didn't have 36 hours we originally planned for. The buses with evacuees started arriving in 11 hours. During the several weeks of emergency response that ensued, there were critical moments when I knew that making the wrong call would add more suffering and worsen the situation of the very people we were trying to help. It was in those critical moments that I was able to draw upon, as you will too, the accumulated knowledge, experience, and values of the public health professionals who came before me. It was also in those critical moments of facing the new, the emerging, the unknown, when you will have to look around you to develop your own tools and arrive at your own answers. In those moments, you will draw clarity of purpose from the individuals, families, and communities who need your help. You will draw strength, inspiration, and wisdom from your colleagues. And you will draw a deep sense of humility and resolve from your own mistakes and your own uncertainty. Now, fast forwarding to 3 years ago, I was offered the sobering responsibility and tremendous privilege to walk through another door and serve as Deputy Mayor for Health and Human Services in my hometown here in New York City. A long, long time ago, in a galaxy far, far away. When I was sitting where you are today, preparing to walk across a graduation stage, I had no idea I would one day be overseeing 11 agencies and mayoral offices serving 8.6 million people. I had no idea that I would be tasked with challenges as varied as addressing a surge in opioid overdose deaths and the global measles outbreak. protecting children from lead exposure and from child abuse, sheltering people who are experiencing homelessness, and helping tenants fight unfair evictions, leading the charge to guarantee health care for all New Yorkers. Never could I have imagined all the doors I would be asked to walk through, the unknowns I'd be asked to face, the paths I would be asked to forge. So today, I stand here with you at another important threshold. I have been given the joyful responsibility and the incredible privilege to be with you as you walk through this big door and step into your own unknowns. As one public health graduate to another, I share with you my favorite definition of public health from the 1988 Institute of Medicine's Future of Public Health. Public health is what we as a society do collectively to ensure the conditions in which people can be healthy. So graduates, as you go forth, remember that no matter what path you choose in this rewarding and diverse field, each and every one of you has an important and trusted voice, the sobering responsibility, and the tremendous privilege to take equitable actions that a just society needs to assure the conditions in which all its people can be healthy. Today is a celebration of your hard work, your accomplishments, and all the times you've already risen to the occasion. So I have no doubt you will be ready when the next opportunity knocks. So get out there, open those doors, step into the unknown, and please show us the way to a healthier future. Thank you, and congratulations, class of 2019.
Deputy Mayor Palacio, please accept this token of our great appreciation, both for your service to the City of New York, as well as your inspirational words today to our graduates. Thank you.
Thank you very much.
And now, join us in viewing this video message from faculty and staff to our graduates.
Public Health Policy and Management congratulates the class of 2019. Woo!
Congratulations, graduates!
Class of 2019, congratulations on making it to this important step along your journey. Remember, bring all of your gifts with you as you continue to champion for health equity.
To the 2019 graduating class, I am delighted to wish you congratulations on your commencement and on all of the hard work and many accomplishments that went into your path to this day. My parting advice for you is to always uphold the highest principles of honesty and integrity in your workings with data and colleagues, and to keep your focus on what is significant, and I mean that in the broadest possible sense. Congratulations and very best wishes to you all.
Congratulations everyone, class of 2019. I look forward to seeing you apply regression to impress everyone in your career. 恭喜大家毕业啦!
Congratulations, class of 2019. You have survived biostatistics, and I hope your time at NYU has taught you that some of the best public health accomplishments start off a little bit uncomfortable and challenging. This should greatly prepare you for your future public health endeavors, be they educational or professional. To our biostatistics graduates, you are our largest class to date. I'm excited for you to set your mark on the world and show them what it means to be trained in biostatistics at GPH.
Congratulations, everybody. It's really great to get to know you over the last 2 years. It's been great for me, for the whole global health team. We've really enjoyed working with you as partners to improve health outcomes in the most vulnerable populations on the planet. It's been great to be inspired by you, to be challenged by you, to be pushed by you, to make this program even better than it was the day you started. Good luck to everybody. Please stay in touch.
Congratulations, class of 2019. I'm so proud of you, and I can't wait to see what you guys do next.
Congratulations, class of 2019, and good luck with your future careers.
Congratulations, graduates. I want to pass along some of the best advice my graduate school mentor gave me. She said to me, what are you an instrument for? Meaning, what are your special gifts and how will you use them?
Congratulations, newly minted PhDs. GPH is very proud of you for obtaining a degree that less than 1% of people receive nationwide. GPH wishes you all the best as you create new knowledge with scholars around the world to fix public health concerns.
On behalf of the Public Health Nutrition faculty, congratulations to the 2019 graduates of the Public Health Nutrition MPH program. It has been our pleasure to work with each of you during your time at GPH. You have all done wonderful things, and we know that you will make terrific contributions to the field of public health nutrition in the future. Good luck.
Congratulations to all the graduates, but especially the cross-continental students. It's time to celebrate. You've worked really hard.
Congratulations on graduation to the class of 2019. We are thrilled for you, and we're thrilled for the world because you're going to make it a much better place.
Please welcome Vice Dean of the College of Global Public Health, Dr. Ana Abreu Lanza.
Good afternoon, everyone. It is my true pleasure to introduce to you this afternoon our first student speaker, Dr. Benjamin Spohr. This spring, Ben successfully defended his dissertation on the use of GPS data in defining food, built, and socio-demographic environmental exposures. And now, among the ranks of our growing class of the doctoral program graduates, please join me in a warm GPH welcome to Dr. Benjamin Spohr.
I can put this away? All right. Hi, everyone. Before I get started, I did not tell my family that I was speaking today. So my notes say that I should pause either to apologize or be jeered, and I guess I'll let them decide. And also to my thesis students, you guys all did great, and I'm putting grades in today. Okay. You all look amazing. My name is Ben Spohr. I am receiving my PhD today. I was never expected to fly so high. At the age of 4, I walked into a psychiatrist's office, an energetic young boy, and walked out a social liability. I was diagnosed with hyperactivity. At the time, the messaging around ADHD was less than compassionate. My mother was told I would be in prison by 30, that my diagnosis made me much more likely to be a felon. Through indiscretions on the part of my teachers and my own obvious maladjustment to the world, I soon became a favorite target for bullies. At this point, my peers and some of my teachers decided that I had no future, and they began to treat me as inconvenient, disposable. Being 4 years old, I internalized these beliefs. I began to agree that I was inconvenient, disposable, and worthless. Today, my past as a social pariah manifests as anxiety and a fear of the unknown. And for the record, I do not recommend bringing an anxiety problem and fear of the unknown with you into a dissertation defense. I was also born with a strong sense of justice. As my third grade teacher said, I felt slights to others as if they were personal attacks, and they all hurt. This only served to deepen my pain. After fleeing high school, I realized being bullied made me see the world differently than the people around me. Though my suffering was trivial in comparison to what the world can offer, I learned it was enough to teach me something about my bullies. I learned about the capriciousness of their cruelty and the uncaring yet systematic way they chose their victims. I knew I never deserved to be singled out, and I knew that didn't matter. Given the deep pain that I felt in the face of injustice, the suffering I experienced aggrieved me all the more. Having been bullied by my peers and angered by the understanding that my experience was both mild and common, I was looking for a way to fight back. When looking for my first real job after college, I wanted a practical way to dismantle the social iniquities that make some people less than others based on nothing but the way they look, what they believe, or how they behave. I never wanted anyone to feel the way I did. I got a job as a holistic health counselor at a public high school on Coney Island. Many of my students knew that society saw them as a problem. Mostly minorities, mostly poor, and mostly fat. They didn't know what they should do to change, to get out from under the world's thumb, nonetheless how they could change it. I tried to teach them about getting their 10,000 steps and eating whole grains while becoming progressively enraged at a world that would bind their wings and then judge them when they could not fly. I saw myself in these students. I too had no idea what I had done wrong, only that I was wrong. I needed a way to fight this both for my students and for myself. Public health is, at its heart, a social justice pursuit. Not only that, it is an exceptionally tangible way to do social justice work. Many people will agree that racism is bad. However, public health can prove racism is killing people. When you tell someone that the stress caused by being a minority in the US will measurably shrink people's arteries, contributing to disparities in cardiovascular disease and stroke, they suddenly struggle to write you off as just another social justice warrior. That is just one really good public health paper. And it's not only racism. Society is a bully that chooses people and groups of people and makes them suffer for deeply stupid reasons, like the color of their skin, their gender, their size, or their sexual identity. We know racism, sexism, sizeism, homophobia, and most other prejudices you care to name can, have, and do kill people. There is no justification for this. I've taught the thesis class for our MPH students for the past 3 years, and public health social justice argument is visible in my students' work. This class allows our students to begin to express their opinions about inequality through the research they choose to pursue. They have asked questions like, what is it like to be a gay Arab man in Trump's America? And what happens to people's health when the rent gets out of control? These are core social justice issues that few others have thought to explore. It reminds me of the reasons I pursued public health in the first place. I wanted to know why we blame obese school kids for embodying the consequences of a world we created. Put another way, my students and public health as a discipline attempts to understand and bring to an end health disparities caused by an unjust society. This then is the promise of public health. Public health gives us a way to talk about suffering and injustice in a language that is impossible to ignore. Our rigorous thought and precise statistics belie our larger mission, which is to create a world in which people do not have to suffer because they were born in the wrong place, in a certain kind of body, or with different preferences. This is not a comfortable time for people who care about the things that we care about. Many people in power do not believe in what we believe and are enacting policies that undermine our collective mission. And in a nation that has made huge steps towards injustice in the past 2 years, it is easy to feel defeated and defeatist. Public health work is our resistance. Through rigorous science, we can speak to people in power and show them the error of their ways. The people sitting in front of me, the ones with the hats, as you may notice, are about to receive a degree in fighting injustice and righting wrongs. Put another way, public health draws together people who care deeply about the world around them and want to change it for the better. For me personally, this is the moment when I prove all my bullies wrong. I am not a felon. Checks in the mail. I am not a felon, and I have a future. They never knew what I was capable of. In many ways, I thought this was the end of my journey, but in fact, it is just the beginning. For all of us, yes, we are here to get a degree and to end one part of our journey. But in a very real way, we are here to bend the moral arc of the universe towards justice. Today is a wonderful day. It is not only a testament to our hard work, our self-belief, and our commitment. Today is the day in which we walk into an unjust world and start bending the arc. Allow me to first congratulate us on everything we have accomplished so far. These are no mean feats. However, our work is just beginning, and the work before us is not small nor simple. With that in mind, allow me to lay the following charge. Enjoy what you have accomplished and take a deep breath. Our next job is to save the world from itself. Congratulations, and let's get to work.
I am delighted to introduce our next student speaker, Vaibhav Srinivasan. He is affectionately nicknamed Vabes, in part because of the vibes, the great vibes that he inspires in anyone who crosses his path. His infectious passion for public health earned him his role this year as graduate president of GPH's Student Governing Council and the International Student Leadership Award by NYU's Office of Global Services. Please join me in a warm welcome to Vabes.
Dean Hilton, honorary guest Dr. Herminia Palacio, distinguished faculty, administrators, friends and families of the graduates, and my dear friends, welcome to the day we've all been waiting for. Now, I know what some of you may be thinking. Oh no, not him again. Well, I can't say this is the last you'll see and hear of me, so buckle up. Honestly, it's going to be so weird not being back at the student space. You know, that's where I met most of you, hanging out there, seeing Andrea's smiling face before we went to class, doing our homework, or just there for the free food and attending club events. In our time here, we have grown from 10 clubs to 16, and it all started because you believed in something and you took on that leadership role. Now, the events you organized were tremendous, where you supported and served the communities by volunteering at social justice expos, talking about incarceration, holding food drives, blood drives, packing kits for the homeless, hosting panels on black women's health, sexual health, LGBTQIA health, mental health first aid training, naloxone training, mapathons. I could keep going on because you guys did so much. You organized everything from the ground up, and you rallied the people, and you championed your cause to spread awareness of what is happening out there and how we can make the first step to affect change and inspiring others to follow suit. In addition to clubs and events, I also know that you guys had full-time jobs, part-time jobs, raising children, working outside, working with communities, doing what you love, all while attending school. And now look where you are today. Your work has inspired me every single day, and I'm lucky to be surrounded by such hardworking, dedicated people. When we look back in our history, change was achieved by those who were not only passionate, but relentless. So much is happening in the world today. We have 126 women elected to Congress. Out of that, a record 43 women of color. We had the first picture of a black hole coded by Dr. Katie Bauman, and we had an uprising led by women overthrowing a dictator in Sudan. All of this in the last 6 months. It started with a dream and a passion, and now they serve as our inspiration. Now, Going to the real world and actually implementing those changes you have championed here at school may seem scary, but is it impossible to achieve? Not at all. We affect change by breaking the status quo, by raising our voices for those in need, and maybe by being a tad bit unconventional. No matter what you face, just know you are equipped with the intelligence and compassion to tackle anything in your way, as you are such beautiful, powerful people, and through this journey of achieving your dreams, I hope you find fulfillment, and also by reminding yourself every day that there is going to be a better tomorrow. So never back down, never give up your convictions, and keep fighting the good fight. I'm proud to have been your colleague these last 2 years, and I'm fortunate to be up here and honor all of you today. I wish you nothing but the best. Thank you so much.
And now we come to the portion of the program where we celebrate our honors and awards. Please join me in welcoming to the stage Dr. Lakante Dill, Director of Public Health Practice and Clinical Associate Professor of Social and Behavioral Sciences.
Good afternoon. My name is Lakante Dill, and I'm the Director of Public Health Practice and Clinical Associate Professor, as she said, of Social Behavioral Sciences here at NYU GPH. We are now going to present the College of Global Public Health Awards and Honors. Our first award is to be presented today is the Public Health Practice and Leadership Award. Nominated by GPH faculty, this honor is awarded annually to students who demonstrate high levels of scholarship and commitment to the public health community, and who have enormous potential for future contributions to the field of global public health practice and service. Please join me in congratulating Emily Drum and Nicole Acero, our 2019 Public Health Practice and Leadership Award recipients. I would now like to introduce Bernadette Bolden-Abala, Senior Associate Dean of Research and Program Development and Interim Chair and Professor of the Department of Epidemiology here at NYU GPH.
Good afternoon and congratulations to everyone. Our next awards are the Research Awards for 2019. Nominated by Global Public Health faculty, these awards are given annually to students who have made significant contributions to public health research here at NYU or in the global community through efforts outside of program degree requirements. Please join me in congratulating graduate students Tina Ko and Ji Wang, and undergraduate student Mireille Miran, our 2019 Public Health Research Award recipients. Thank you. Tina, congratulations. Congratulations. And Mireille. Congratulations. I'm now pleased to introduce Jennifer Pomerantz, who's our Assistant Professor of Public Health Policy and Management here at NYU GPH, who will present our next award.
You guys are amazing. I'm so proud of you. Thank you, Dr. Bolden-Abala. We will now present our 2019 Public Health Social Justice Awards. These awards are nominated by the GPH student body and is given annually to students who have made significant contributions to improving the life conditions of vulnerable populations, communities, and individuals through efforts outside of the degree program requirements. So please join me in congratulating our MPH graduates, Bibi Ndala, Dior Vargas, and our undergraduate. We'll start with them. And our undergraduate, Colin Kimberlin. Thank you. Thank you. Thank you. Thank you. Congratulations. Woo! Thank you. Thank you. Congratulations. Our 2019 Public Health Social Justice Awards recipients. Thank you. Now, please join me in welcoming Dr. Joyce Moon Howard to the stage. She's our Director of Undergraduate Programs and a Clinical Associate Professor of Community Health Science and Practice. She will present our next awards. Thank you.
Congratulations, everyone. And I'd like to thank Professor Pomerantz. We will now present our 2019 Service to Community Awards. These awards are given annually to students who have made significant commitments to community engagement at NYU or in the community through efforts outside of program degree requirements. Please join me in congratulating Rua Elker and Dina Yolanda, our 2019 recipients. Congratulations. It is now my pleasure to introduce Agrejo Baja, our GPH student representative who will present the next award.
Hi. Each year, the graduating class is asked to nominate the faculty member who they feel provides exceptional instruction and care to their students. Please join me in congratulating Dr. LeConte Dill, the recipient of GPH's 2019 Excellence in Public Health Faculty Award.
And now we welcome Dean Cheryl Healton back to the podium for a special message.
It is a bittersweet moment in our ceremony that we thank Dr. Bernadette Bowden-Albala for her extraordinary service for the past 5 years here at GPH. She joined us in 2014 when we were a small global institute of public health and worked tirelessly as our founding Associate Dean for Program Development. Since then, she has also served as Senior Associate Dean of Research and Program Development, as well as Interim Chair of our Epidemiology Department. We thank her for her key role in the oversight and direction of our innovative cross-continental MPH program and the many other key efforts she undertook while with us. Bernadette departs this summer for the University of California, Irvine, where she will be the founding dean and director of the Planned School of Population Health in the Susan and Henry Samuli College of Health Sciences. I'm sure I did not justice to that name. Please join me in applauding Dr. Bernadette Bowden-Albala. I know you weren't
Can I say thank you? Can I say thank you?
Yes, you can
One
give it back.
second.
Yeah, you can
I'll
give
give
this
this
back.
back. So I know we want to get on with the most important thing, which is students graduating today. I just want to say, you know, even though you're getting your master's or bachelor's or PhDs, and you think it's the end of education for you because, of course, you won't have to take tests or do papers, it's just the beginning, and every day is an educational experience, and I've not ever had a better educational experience than the last 5 years here. First, to all of you students, to the Department of Epi, to the cross-continental students traveling around the world. It's been absolutely
absolutely wonderful, but most of all, to Dean Hilton and to the faculty, I have learned so much from each and every one of you, and I will take that with me wherever. Thank you for your grace and kindness, and thank you, NYU, for having the thoughtfulness to build a great College of Global Public Health. Thank you very much.
And now, for the part of the program we've all been waiting for, the presentation of our students. But first, a few words from some of our graduates.
I did tremendously enjoy my analysis of epi data using SAS with Dr. Emily Goldman. Her enthusiasm and excitement for public health is infectious.
My favorite professor at NYU would have to be Dr. Dill, and she really took a lot of us under her wing and was a great mentor to us.
Justice in Healthcare with Adam Lerner.
Health policy with Dr. Diana Silver.
Global issues of non-communicable diseases.
My favorite class was with Professor Laura Singh, psychometric measurement.
I'm gonna have to say that my favorite professor is Dr. Abramson. He's really amazing and manages to create this awesome environment where we talk about super intense topics, but still manage to balance everything with like a really funny conversation after class. So I really appreciate his guidance throughout this whole process.
At my time at NYU, I was on the Student Governing Council for GPH.
Help with the creation of some school resources for a documentary about people crossing the border in Arizona called Undeterred.
I was part of CPR, which is Community Preparedness and Response.
While at NYU, I actually was a co-founder of an organization called the Black Women's Health Collective.
I was part of the Search Lab that focused on stroke research. My favorite event was planning Salsa in the Park, where we got to partner with NYC Parks and Salsa Dance Studio in Brooklyn.
During my summer practicum, I studied in the Measurement, Learning, and Evaluation Lab under the direction of Dr. Melody S. Goodman.
I was involved as a research assistant at the Agent-Based Modeling Lab and at NYU Access and the Applied Global Public Health Initiative.
I worked as a research assistant at SEED program, which is led by Professor Mary Bragg.
To be honest, NYU has been my dream school since I was a kid, so the fact that I got this chance to come here, you bet I jumped at it.
This experience at NYU has taught me that I'm much more capable than I realized.
I've also got to make a lot of different connections from people here in the United States and especially globally within London while I was studying there.
The capstone experience is something that really made me realize that my work is able to make an impact.
I want to go back to my country, go back to Brazil, because I know that there is a lot of things to do in my country and things that we can grow. As a public health professional, I know that I can help.
My time at NYU, I found professors who genuinely cared about me and were passionate about teaching. So much and so that I will be continuing my master's at NYU College of Global Public Health.
So after I graduate, I'm really hoping to go into humanitarian response and disaster aid. So I'm really hoping to go into a field where we can bring health equity to people. I'm sure that's what everyone else in our program is striving for as well.
I really want to work with vulnerable populations and marginalized populations, specifically in mental health.
I would like to work in the areas that impact Black women and Black women's health. I would love to be kind of a voice for them through research and highlight some of the disparities and issues that we have.
I want to take on big pharma and make healthcare accessible for all.
I hope to be able to highlight disparities in education and find ways to bridge gaps for minorities and just really connect people to what their passions are.
I'm hoping that my research will help implement new programs to help people who are suffering from respiratory diseases, specifically like COPD.
Mom, Dad, I know I love you so much. Thank you so much for your support. To my amazing friends, Tina and Amanda, you guys got me through this whole program, so thank you so much. Couldn't have done it without you guys.
Shout outs to the amazing Student Affairs team for getting us here.
Thank you to Andrea, to Angel, to Angelica, to Julie and Kristen. Your support during these past 2 years has been amazing. Thank you for everything.
Shout out to my mum and dad back in Manchester and the entire bioethics team. We're small but we're mighty.
Huge shout out to my family, to my husband. I miss you so much, I love you, and a shout out to my friends also.
Shout out to my mom, to my dad. Thank you for everything.
I'm definitely going to have to give a huge shout out to my family. You guys have always been super supportive of me. All the friends and connections I've made at GPH, I really hope that we stay in touch because you guys have been amazing.
I would like to give a shout out to all of my friends that I've made over the time that I've been here.
After I graduate, I'm gonna miss the faculty and staff here, and I'm also going to miss eating crepes at midnight.
I think I'm also gonna miss 726, being in the common area with all of my friends.
Everyone really understands when you're stressed about something, they say, you know what, we're all gonna get through it, and I'm definitely gonna miss that the most.
It was such an incredible, open, and welcoming space where you can interact with your peers and faculty.
We've been like studying together, group assignments, and we kind of developed a small little family here.
And to the class of 2019, we've made it, and we're gonna do really awesome in the field.
Introducing Dr. Nyati Parekh, Director of Doctoral Studies and Associate Professor of Public Health Nutrition.
Good afternoon. It is my honor to present our students receiving their Doctorate of Philosophy in Public Health. To assist with the hooding of our doctoral graduates, I welcome Vice Dean Ana Abraido-Lanza to step forward, please. I now invite the students and their mentors to the podium. Dr. Preeti Bundy. Her dissertation title is The Evolution of Educational Inequalities in Tobacco Use in Low and Middle Income Countries. I also request her mentor, Dr. Diana Silver, Associate Professor of Public Health Policy and Management, to come to the podium. Dr. Priscilla Mulicheri, whose dissertation title is Brazil's Health Policies 2000 to 2013, Did They Reduce Health Care Inequalities? Her mentor is also Dr. Silva. Dr. Rachel Pilch-Loeb. Her dissertation title is Optimizing Risk Communication in an Emerging Threat, Evidence from the Zika Virus in 2016. And her advisor, Dr. David Abramson, Clinical Associate Professor of Social and Behavioral Science. Dr. Nessa Ryan, whose dissertation title is Stigma and Coping Among Women Living with Obstetric Fistula in Ghana, a Mixed Method Study. And her mentor, Dr. Bernadette Boden-Albala, Senior Associate Dean of Research and Program Development and Interim Chair and Professor of Epidemiology at GPH. And Dr. Elizabeth Stevens, whose dissertation title is Advancing the Practice of Implementation Science and Evaluation of the Factors Contributing to the Use of Implementation Science in the Health Research Community, whose mentor is also Dr. Albala. And last but not the least, Dr. Benjamin Spohr, whose dissertation title is Built Food and Social Demographic Environments in GPS Geographies and Their Associations with BMI, Obesity, and Type 2 Diabetes. His mentors, please step forward, Dr. Brian Elbel, Associate Professor, Department of Population Health at NYU's Langone, and Dr. Virginia Chang, Associate Professor of Social and Behavioral Sciences. Congratulations to all. Thank you.
Now, introducing Dr. Zachary Maggio, Associate Dean for Enrollment Management at GPH, and Dr. Julia Vina, Senior Associate Dean for Student and Alumni Affairs, who will present our students earning their Masters of Public Health degrees.
I am honored to present our graduates alongside Dean Avina. First, we will present our graduates earning a Master of Public Health degree. Khaled Khalif. Ao Zhang. Joshua Wang. Xiaoyan Zhang. Alan Yan. Courtney Goodman Watson. Yidon Zhang. Hind Al-Marzougi. Aaron Hall. Elizabeth Hutzel. Maria Mayango. Henna Goel. Ejiro Baje. Jacob Sim. Emily Drum. Vaibhav Srinivasan. Rua Elker. Bibi Nadala. Tina Koo. Jay Wang. Dior Vargas. Wenla Jung. Tamina Ahmed. MD Rahman. Angeline Pierre. Samaria Filosa. Charlotte Kurz. Daniel Guerrero. Michelle Muska. Divya Narala. Tone Yue Wong. Jie Yang. Liz Calderon. Yufei Chan. Alicia Siling Asala Leili Faezo. Stephanie Fisher. McKenna Riley Rutan. Ellen Saltzman. Christina Marini. Giovanni Apollon. Katerina Colon. Tierra Starkweather. Florence Gabrielle Pierre. Rebecca Glenn. Darshini Patel. Manpreet Suchdev. Sophia Rivera Perez. Jesse Drescher. Corbin Kapler. Emily Holzman. Esma Tekbali. Now Tojo. Huzi Wang. Valicia Enriquez Pichardo. Magali Azucena Romera. Isaac Nar Noble Saki. Somaya Al-Shalk. Sivuile Maricana. Melissa Monroe. Alyssa Penizotto. Alyssa Kurtzman. Hannah Parsons. Molly Hirsch. Clayton Richardson. Ariana Traub. Gabriella Quintard. Molly DeRoy. Asuncion Ween. Benjamin Schramm. Brianna Speck. Vaishali Trivedi. Mandy Lynn. Felicity Bell Duran. Jerome Valoria. Taylor Louise Kennedy. Denise Vega Perez. Manasvi Marathe. Kavitha Verghese. Ami Padan. Amaris Mercado. Corey Hughes. Seth Bedu. Kevin Lee. Corey Johnson. Aisha Iqbal. Megan Durr. Shreya Patel. Audrey Sloma. Saba Raymond. Marla Sharp. Ashley Newcomb. Sasha Raman. Alok Mehta. Wanho Liu. Herman Deep. Marsol Macedo. Genesis Valle. Sheena Thakar. Azmeta Vadali. Brittany Wolf. Alex Morisano. Mohammed Ansari. Emily Gill. Mohammed Hussein. Yanrong He. Luyao Wang. Ifan Shu. Yan John. Funing Yang. Fonya Yao. Shine Zhou. Bin Liu. Ying Shelley Zi. Lisa Gill. Maya Narayanan. Ashley Jean-Louis. Benjamin Search. Don Bo. Jia Ray Ho. Zhao Zhui Yu. Nikita Grant. Hannah Capadia. Jessica Velasquez. Amber Lynn. Christy Way. Oh. Nicole Freyer. Wow. Abigail Merced Maldonado. Juliet Hernandez Carrasco. Naveen Shoaib. Nada Gamia. Michael G. Abduranos. Kojo Asiedu. Xiao Fan. Mohammed Umair Masood. Enrique Francis. Akshata Dahake. Gurleen Kaur Dillon. Kirna Pandya. Sucharitha Gadi. Nauka Patel. Himanshi Bhatt. Krishna Dixit. Ruha Zahor. Mutushi Kundu. Anita Venkatesan. Amanda Lanetza. Michelle Quarky Rosa. Amal Al-Ruwaili. Christopher Park. Nilufar Fuladi Nashta. Ida Amadi. Kristen Pierce. Dina Elmanshed. Cassandra Jones. Jessica Medina. Diana Sumi Klatt. Gabrielle Khalif. Naomi Heisler. Lauren Dozier. Brooke Tortorella. Kevin Lovengood. Joanna Phillips. Ramon Alvarez. Dennis Kunichov. Erica Finfer. Gina Gonzalez. Rochelle Jacoby. Tatiana Bush. Greg Poorman. Faisal Adam. Taha Alhazmi. Ari Joseph. Bohan Yang. Love Jones Rennie. Sarah Bender. Janie Sachania. Prajakta Karakar. Lynn Johanni Estriplet. Sarah Philippe. Claudine Lavarin. Okay. Khadija M. Davis. Allison Cole. Letitia Cabaseli. Chantal Vanessa Manning. Martha Nasali. Zakwani Zulu Olobede. Congratulations to our MPH graduates. Now we will present our students earning the Master of Arts degree in bioethics. Please join me in welcoming Dr. Matthew Liao, Director of the Center for Bioethics and the Arthur Zittrain Professor of Bioethics, who will help congratulate our students. Dr. Liao, please join us at center stage. Doctor, he's there. We're ready. He's there. Isabel Tiger Smith Avina. Josh Neto Rosen. Jamie Webb. Doyen Akintobi Adiyeye. Remya Ramachandran. Alexandra Bonwell. Jessica Lochtenberg. Paul So. Congratulations to our MA in Bioethics graduates. And now we will present our students earning the advanced certificate, and we will present our student earning the advanced certificate in public health. Iquia Cordier.
Now it's my turn. Thank you, Dean Maggio. I'm going to put this up. 1 second. taller than you. Okay, undergraduates, are you ready? Come on now, I sure hope you are. We are very, very, very proud to introduce our new undergraduate graduates, class of 2019. So, let's begin. I need to invite Dr. Joyce Moonhoward to the stage, our Director of Undergraduate Studies in the College of Global Public Health. Joyce is ready? Let's begin. Andy Mendoza. Priyanka Upsani. Stephanie Mao. Joeleni Moran. Nicole Acero. Colin Kimberlin. Marai Mirham. Dina Johannes. Akira Limtha Vimampagal. Erica Granados. Dandapati. Akshitha Dandapati. Rachel Levy. Gabby Throp Reyes. Anthony Derek Bielo Jr. Congratulations. Sahidi Karnati. Joseph Sullivan. Valeria Samim. Liam Ryan. Natalia Ramirez. Nairi Sophia Wells. Caitlin Evans. Nice hat. Whitney Collado. Samantha Skirbo. Sumin Lee. Congratulations. Priscilla Kim. Sorry. Megan Ruprecht. Sophia Barker. Idan Falek. Jaya Savita Iyer. Skiki. Paula Skiki. Andrea Carrazas. Supriya Love. Sarah Sirfas. Haley Majitha. Sally M. Yassim. Navea Saeed. Diana Mora. Sarav Patel. Aliyah Symes. Paja Rocky Ballet. Nadira Narain. Right there. Sindhuja Sriskanda. Mei Lee. Brooke Yang. Rafia Gutene. Yes. Shazel Shah. Oh, I'm sorry. I'm going to start over. Brianna Van Lunen. Congratulations. Rindala Alajaji. Shizuku Yoshida. Sydney Ernstberger. Jennifer Gonzalez. Emily Rabinowitz. Congratulations. Bariha Deradunwala. Mahad Magan. Camila Yepes. Julian Halim. Christy Ga. Joseph Santor. Congratulations. Yanai Segal. Janelle Boafo. Tanya Johnson. Fahad Iqbal. Danielle Mareke. Elizabeth Murray. Cindy Ho. Sadia Alam. Zoe Costamiris. Maisie Zimmerman. Aisha Medina. Catherine Bierkins. Juani, okay. Juani Rodriguez. Uh-oh. Orville Edwards. Is that it? Congratulations, everybody. Can we hear a little bit of a hollering? Parents? Audience members? Yeah. Congratulations. I'm done, right? We're taking a moment so you can soak this in, so you can really just feel the energy. One more congratulations to all of you. Graduates, please look inside your new portfolios and you will find a copy of the Universal Declaration of Human Rights focused on health, first delivered to a School of Public Health by the late Dr. Jonathan Mann. It's a document to live by as you head into the world to conduct research and practice public health. You now join our alumni and can cheer us on as we work to achieve a bold goal to be in the top 10 schools of public health in the coming decade. We look forward to hearing about your inspiring contributions, and I know they will be many, and we wish you health and happiness as you embark on the next phase of your exciting careers. Exercise your heart as much as you do your mind, and you will make a real difference, because caring is the greatest motivation of all. Family and friends, I ask that you please allow the faculty and the students to recess out of the auditorium first. I wish you all the luck in the world, and I thank you for being here. Congratulations, one and all.